Hey everyone, this is Dr. Perry Nickelston from Stop Chasing Pain and StopChasingPain.com coming at you for the first little mini webinar called How to Choose a Therapy Laser, Essential Questions That You Must Ask Yourself. And one of the reasons that I wanted to get into doing this particular topic is there's a lot of misinformation out there about laser therapy, and I want to really make it pretty simple for you. And one of my favorite quotes that I use all the time is by Albert Einstein. It says, "If you can't explain it simply, you don't understand it well enough." And that's so true. So I'm really going to keep this short, simple, sweet, to the point, and just share with you some applicable things that have worked for me over the course of the last 10 years. So that's kind of my story there. That's me on the bottom right there, and then Pain Laser Center is the first laser center that I started here in New Jersey, Ramsey, New Jersey, Bergen County, about 7-8 years ago. And I've been using lasers for about 10 years. Started using low-level lasers, class 3, then worked up to the class 4 lasers. So I'm in the trenches every day using this on real people for real conditions. So I really believe in it with every single part of me as a doctor and a person, the amazing things that I've seen occur with people that I can help. I specialize in difficult cases, very tough, challenging things that other doctors can't fix or give up on, and the laser has been absolutely instrumental in me building a very thriving practice that helps a lot of people. I also teach and write a lot about laser therapy and other types of things that I do for helping regularly figure out exactly how you apply the laser. So I mostly write for industry trade magazines and publications, a lot for Dynamic Chiropractic and Chiropractic Insights magazine, things like that. And I also do travel the world and teach for AMLA, which is the American Institute for Medical Laser Application. Basically teaching doctors, how to choose a laser, science, fix the science, physics, and stuff like that, and more importantly, how to use it to get great success. So, but enough about me. I just want to kind of give you an idea about that I actually use this stuff every single day. A lot of people will talk to you about laser, but they don't really actually use it, or may just be trying to sell it to you. So why did I want to do this little mini webinar here? Well, mostly because there's a lot of misinformation out there. That people call me all the time and ask me different questions of, is this true about laser? I mean, what's the differences between all of them? How can I use them in my practice and stuff like that? And it can be very overwhelming. I mean, I remember when I got into lasers for the first time about 10 years ago, there wasn't as much information as there are now. And sometimes that can kind of be actually beneficial. So now there's so much, you really don't even know who to believe. Somebody tells you one thing, the other person tells you another. But I'm just really going to break it down simple and tell you the 5 things that really, really mean the most, and help you kind of discover your reason why you want to get into laser. And that's going to be the number one thing that we're going to talk about, which is really just determining what you want to get out of laser, and that's going to make a difference on the type of one that you're going to choose for your practice that you're in, your paradigm, your practice technique and style and stuff like that. And I'm going to go over the mistakes that I made and a lot of people have made getting into laser therapy by pulling the trigger a little bit too quick or making decisions based on price alone. So when you're getting out into the world of high-end medical laser therapy equipment, it's not going to be cheap. I'm going to tell you that if you go into the world of the ones I'm going to talk about. But I tell everybody, if you want to play with the big boys on the big boy playground, that's just some of the stuff that you're going to have to suck up and you're going to have to do. So let's move into here. I'm going to full disclosure everything on here, and then I'm all about sharing information and speaking from the heart and telling you the truth on everything. I can tell you now that I'm a class 4 laser therapy user, and that's the one I'm going to push you towards because it works for me. I mean, I have great success with it. I prefer it over the other ones, but I'm going to leave it up to you to make your decision. But I am going to be a little biased towards that, but only because I'm going to show you why that way. Not just because I dislike the other ones. It's just that it works more for me and my practice style and my practice technique. You don't have to go for that. That's entirely up to you, but we're going to help you get to that point. I just want you to make sure you choose to get that type of laser, either class 3 or class 4, based on what's going to resonate with you and your practice. So I do use the LightCure LCT 1000 10-watt laser, and I do some consulting work for them as well. So I travel and teach and try to train doctors on exactly what laser does and the true differences between all the different types that you have. And it's really just about education. And then you can make your own informed decision. So there's no ulterior motives here at all. Just teaching you and helping you get to where you want to go, because it's not about you, it's not about me, it's about your client, and I want them to have the best success. So let's move into the number one reason, and that's why. Why do you want to get into laser therapy, and why do you want to use this modality? That's kind of like the thing on the bottom there, the bullseye. It's not about the what you're using or how you're going to use it. Yes, that can come into play when you choose one, but it's really why you want to use it. What is your objective with laser, and what are your goals? Which means that if you want to treat certain conditions, say for instance spinal stenosis, hip bursitis, deep muscle type of tissue conditions, and chronic problems, you're going to have to cross over, and you're going to have to get into different classes of laser, because the different lasers do different things depending on what you're trying to do with them. You're not going to be able to do the same thing with a class 3 laser that you're going to be able to do with a class 4 laser. It's just beyond the scope of the physics of what it can do, and I'm going to explain that to you a little bit more in detail. So it's not so much that one is good or one is bad or one is better than the other. It really just depends on what your objective is. What is it you're trying to do? And you have to choose the right tool to get you where you want to go. So, and in your practice, do you want to use laser as just another type of modality? I mean, do you want to use it in conjunction with ultrasound? Do you want to do muscle stim, things like that? Maybe it won't be a primary focus for you, and you want to just zero in on some superficial conditions like maybe some tendonitis or superficial type of things, muscle sprain strains. Then you might want to go with a class 3. Class 4s are going to let you expand out beyond and be able to treat anything that's going to walk into your door. So that's and you have to determine if it's something that you want to do with insurance or cash, because right now insurance companies really don't cover laser therapy, and I don't really see any plans for them to do that. So you have to kind of get into the scope of your own mind and your own paradigm. Is it's something that you want to just get so you can bill for and make more money? Then you can get a really cheap one and just go at it. Or is it something that you want to get the best piece of equipment to give you the best results, that you're going to get people well, they're going to refer people into you, and then you're going to build a word of mouth business on integrity, character, honor, reputation, and having good equipment and be the best person around to do the job that you have no problem charging cash for, because you know you're going to get great results. You can believe in the tool that you're using. And so that's a very, very big difference between the two in your own paradigm in your mind, and you really have to look at the results that you want, because you will not use a class 3 and a class 4 laser the same. They have different results. They have different applications. You can't use one on one person and one on the other for the same way and get the same results. It's physiologically not possible based on the type of laser that you're going to be using. So you have to determine why. So it's not a bad thing if you want to go the other way and use that class 3. That's fine. But if you want to use the 4, I just need you to be at the crossroads to determine which way that you ultimately want to end up going. Number 2, choose your class. There's different types of lasers, class 2, class 3, class 4, and therapeutic lasers, and basically the difference in power is their difference in its ability to penetrate deep into the body, to deliver you an adequate dosage of to a target tissue of the healing injury that you need to have. And it really is based, classification-wise, on the possible damage to the eye. So, class 2 lasers have less chance of damaging the eye. They're kind of like scanners or copiers or grocery machine lasers. And then class 3 are low-level cold lasers, about 500 milliwatts or less. That's the average ones that are out there in therapy. And then you got your class 4. And class 4 is the top end, and you can go anywhere from high-powered deep tissue therapeutic lasers of anything over 500 milliwatts all the way up to lasers that shoot things out of the sky. There's no other classification on those things. So in regards to safety of use on that, it really just comes down to the training that you get. If you train correctly and you watch what you're doing, you pay attention to what you're doing, you're not going to hurt anybody with laser. So anybody who says that don't go high power because you can hurt somebody, I'm like, yes, you can. But in my opinion, I'll tell you quite honestly, you have to be a total idiot to do it. I can hurt you with a hammer if I don't know how to do it. It's not the tool's fault, it's the person who's using it. So that's not a valid argument at all in regards to therapy. So the classes determine exactly what your depth of penetration is and how much of a dosage you're going to get, and then those are the factors that determine your outcomes. Because dosage in medicine is determined by joules, and laser medicine is kind of like medication in the world of traditional medicine. If you need an antibiotic or a drug to get you to a point from point A to point B where you feel better, you need a certain dosage of milligrams to get the job done. If you don't get the right dosage, you're not going to get the desired outcome. Laser is the same way. Laser may be what you need, but if you don't get the right dose, you're not going to get the results that you want. So if, for instance, you need 200 joules of energy and you only deliver 100, you're not going to get the outcome that you want. So power makes a difference in how deep it goes, how much you get to your target, and how long it's going to take you to deliver it there. Number 3 is the wavelength, and wavelength basically with laser determines exactly what you're trying to do with the laser. Lasers do different things depending on what you're trying to do and what your ultimate goal is. So in the spectrum of light, you have lower nanometer ones. At the 541 you see on the left, that's a green laser, and that really is a superficial type thing, and it doesn't penetrate very far into the body. And then on the right side, you've got a laser pointer there, 630 nanometers. That moves up into the red range, and that's going to penetrate deeper into the body, and it's going to go through the soft tissue structures that have a tendency to absorb light, like skin, fat, hemoglobin, blood, all sorts of things like that. So most therapy lasers, when you get into them and you're in the 3 and 4 range, they have to be in a particular spectrum of around anywhere in the 800s to the 900s. So most of these guys will be in that parameter. Some of the lower power class 2s, maybe 3s, will have some of the lower ones there in the 540 range or 600 range. It depends on which one you're getting. You're not going to get the depth of penetration on that simply because it's the physics and properties of the light. So the ones that I recommend to get the best outcomes, at least from my experience, are to check your wavelengths and see if you're actually in that spectrum. And sometimes you'll have more than one wavelength, and that's fine. It just really makes sure that you've got one that's in that parameter of what you're looking for. And because if you can't reach your target, you can't get the therapy that you need to. So most of your laser manufacturers will disclose their wavelength to you, sometimes in the paperwork they give you or on their website. Number 4 is training. Training makes a big difference in the laser that you're going to choose, simply because it's only as good as how you use it. So there's no doubt that the right laser that you choose can give you some fantastic results, but you can get different outcomes depending on who's actually controlling it. So make sure that whatever laser you get some really nice quality training from the company, so they train you in the art of the application. You have a good support structure for maybe some things and you have questions on some difficult cases, and your education is there from continuing education and webinars and conference calls and different things like that to help you get where you want to go, not only in just the application but the integration and business and marketing side of it as well. So I help doctors as much as I can on that when they call me, because I say that the easiest way to get from point A to point B is to duplicate the success of somebody who's already doing it. So that's kind of what I do, is I share my success with you. And make sure it's hands-on training. You can't get it from just opening up a book and saying, point here, point there. You have to really see it, feel it, touch it, learn it, do it. You just learn by doing, and that's how you remember, and that's how you get good at it. So make sure that your support structure there is adequate, and then you speak to other people that are actually using it out in the field, and they can back that up from the claims that the company's making. Number 5 is watch for the fluff. And you're going to get a lot of that, because I want you to remember that no matter what laser company you deal with, their goal is to sell you a laser. They're in business to sell you lasers. And some sell it to you for the right reason, because they want you to do well, and some sell it to you because they just want to make money. And they don't care whether you do well or not with it, because once they sell it to you, they're done deal, they wash their hands. So sometimes they're like a used car salesman, and you have to go in with that aspect of it until you learn differently about how they treat you, from the quality of the customer service to the patience and care that they take and dedication to really teach you and educate you, and then help you get to where you want to go. So what you want to do is see if you can get a test run on the laser. Most reputable companies will let you use the laser for maybe a period of time if they work that out, or they'll come into your office and they'll run the laser on some patients that you are having some difficulty with, and you can see firsthand how it works and get a feel for using it yourself. And when you do that, get the feedback of the patients that you're treating and have them say, hey, I really liked that laser better than the other one. I just felt better results with it. They will let you know which one they like by how good they feel and other things like that. And make sure that you get a feel for the laser as well, which means that you use it, see if it resonates with how you are going to be using it for their programs and protocols, because even if you do get a class 4 laser, they're going to be used a little bit differently depending on the manufacturer that you get. They're going to have different fibers, they're going to have different programs, they're going to have different applications. So you got to see which one kind of fits in with you as a doctor, but also your patient flow and your office flow and your practice paradigm. And things that you want to integrate that thing in with as well. And speak to others. Make sure you check with all different types, people in your field, people in another field. Then ask them how they like it and how long they've been using it and what the support is and things like that. And then just watch sometimes for the cloak and dagger that I call it. I mean, people will throw stuff at you like pulsing or frequency changes or all this kind of stuff, and then you can get really, really confused. I can just give my own personal experience. I've really never seen a need to have any pulsing or super pulse or frequency changes in the lasers. It's nice bells and whistles and looks pretty fancy in a brochure or on the laser. But I pretty much keep mine a continuous wave all the time, and there's very little literature, at least the last time I checked. If anybody has some out there, you can certainly send it to me. That shows the efficacy of using pulsing or frequency changes. To me, it just cuts down on your treatment time, but that's a personal choice on your part. But for me, I like to keep it simple, keep it effective, get in, get out, and just get the results that I'm looking for. And the last thing I'll tell you is don't make a choice on price. I mean, if you've got two things side by side and one is more than the other and the other one is less and you're not giving you what you want, don't nickel and dime it for trying to save yourself a couple of grand, because I'll be honest with you, you're gonna regret it in the end from the results that you're gonna get from your clients. And most people will choose to lease the laser when they do it, which is very, very simple, and a couple of $1,000s only makes a difference of maybe not even $5, $10, $20, who knows, whatever you're going to have with your lease in the end. So high-end pieces of medical equipment are going to cost you, but you're going to get what you want out of the laser, and more importantly, you're going to get people well, because the most expensive piece of equipment you're ever going to get is the one that sits in the corner and you don't use it and you're very disappointed in the outcomes of it. So make sure you really pick on price last. Look at everything else first and then go by price tag last. And I will tell you now, when you're branching into the class 4 arena, you will be paying a lot more than you will for class 3s. That's just the way it is. But if you want to get into this realm and get to the high-end medical class 4, you're going to have to do it. So let's go on some final thoughts here. I love laser. I think it's probably the most amazing form of therapy I've ever used in my years of clinical practice. One, because it's based in physics and science, and it actually regenerates and heals the body on a cellular level, and I love that. So I can always make some positive changes on people. And remember, it's only as good as the tool that you're going to choose and how you're going to use it. So the selection process is something you definitely want to take your time on. And I made my choices by using all different types over the course of the last 10 years, just getting feedback and seeing what resonated most with me. And I'm at a point now where I've got the perfect system. I got the laser that I think is the best one out there, and business is thriving. And now I just kind of want to share that with you to help you get the same results that I'm getting and be able to change the lives of people, because that's really what it's all about and why we do what we do. And if you have any questions, you can reach out to me. You can visit me at stopchasingpain.com. That's one of my websites, and the other website is called painlasercenter.com. One is a little bit more medically oriented. The other is a little bit more oriented towards contacting with doctors and general public. And then you can also visit the LikeCure.com to check out the laser that I use and kind of see that in action and see some testimonials and videos on my website as well as theirs. And that number right there is my direct cell phone number, 973-800-6570. And you can call that anytime. Ask me some questions. I'll be straightforward with you and honest with you and share with you what I think and what I would recommend for you. And if you have a laser now and you have questions on it, feel free to give me a call as well. So I hope this was a little bit informative for you and you enjoyed this one. Kind of just clear through the clutter and give you the baseline simple 5 ones that really, when it comes down to it, that is all that matters. So thank you for tuning in. This is Dr. Perry Nickelston from StopChasingPain.com. You have a great one. We will see you soon on the other side.